Okay, so today we are going to be talking about concussion pathophysiology. My name is Melissa Gutheil. I am a licensed and certified athletic trainer, so I will be discussing this information with you. First up, what does pathophysiology mean? So pathophysiology is a combination of pathology and physiology. Pathology is the cause and effect of what causes diseases, and physiology is the normal function of the human body. So the two together is the study of disordered physiological processes that cause, result from, or otherwise associated disease or injury. So first we're going to talk about concussion. So in this picture, it shows somebody getting a concussion and their brain hits the skull. And this happens due to any type of trauma to the head, such as head down tackling in football or even a car accident. So inside the brain, there are millions of neurons, millions of thousands of neurons, and they all use their signals to communicate with other neurons to talk about, this is how you think, this is how you speak, this is how you move your hand. Everything is communicating through these neurons. So this is a picture of a neuron. This is what they kind of look like in an artist rendering. Obviously, this is not exactly what they look like, but this is a good simplified picture. So you have one end, which is the cell body, communicating with another. So you can picture it kind of like a CAN string telephone line. One end is communicating with one another, and they send information through that string. So some of the important molecules that are involved in this process during a concussion is potassium. So we can think of potassium as bananas. Everybody knows bananas have a lot of potassium. So when you see the bananas, you know that's potassium. And calcium is another important molecule. And we know that a lot of calcium comes from milk. So when you see the milk, you know that that's calcium. So in this picture, we have all of these potassiums sitting in the neuron. So all of the bananas are currently relaxing in there, and right as head trauma occurs, we get all the potassium leaving the cell, which is not what we want to happen. This is really important. Potassium should remain in the neuron at all times, so this is an issue that this happens. So after a head strike, we see that all the potassium flies out of the cell. And then we get another neuron, which now no longer has potassium, but calcium flies into the cell. And this is a problem because calcium isn't normally found in the cell. And to the cell, it is toxic. We should not have calcium in the cell. And this is an issue due to the concussion. In addition to the calcium inside the cell, we also get a decreased cerebral blood flow. So less blood is getting to the brain, which just automatically sounds bad. But this can remain for a couple days, so this might be the biggest contributing factor to a concussion symptom. So what this produces is a decrease in energy. So the brain is hangry. It is not getting the nutrients it needs. It's missing what it needs to function. So it's getting really hangry. It's showing these symptoms of headaches and dizziness and nausea, all these things that you see with concussion. The brain is hangry. It wants its nutrients. It is missing a lot of the energy it needs to work. It wants to produce a physiological pathway called glycolysis, but it cannot. It's in hyperglycolysis. But most of the energy is missing, which again causes that brain to be hangry and causes all these symptoms that you see. So in order for the brain to accomplish what it needs to do, it needs to conserve its energy. So we are trying to conserve all the energy possible that you can keep. So remember this meme, conserve your energy. And we do this by recommendations for rest in academics, work, and sport. So with a child, they shouldn't be going immediately back into school and sports. And if it's an adult, maybe working would exacerbate the symptoms. So you want to conserve the energy and make sure you're not pushing forward. So again, everything that the brain is missing, the nutrients, it's having calcium in its cell when it's not supposed to, the potassium left, it's not getting all the nutrients it needs, the blood flow is lower. We want to try to conserve our energy so these things don't hold us back. And that's all for today.